For over a year now, Africa's healthcare systems have been stretched thin by the coronavirus pandemic. Over 100,000 people across the continent have succumbed to the disease, many of them doctors and nurses. With a second wave now spreading through parts of Africa, experts agree the only way to firmly end this pandemic is through widespread vaccination campaigns. Unfortunately, the majority of Africans may wait up to 2 years to receive their doses. In this episode of Panorama Africa, we take a look at unequal access to vaccines and life-saving medicines in Africa. It's another busy morning at the Hiwatele oxygen plant here in Nairobi. Since 2014, this social enterprise has been quietly supplying oxygen to patients in public and private health facilities across Kenya. But it wasn't until the coronavirus pandemic that the country's health sector really paid attention to what happens here.
The most memorable time was around October, November last year, 2020. That's when the mortality was quite high. We had hospitals coming to this plant and basically fighting for oxygen.
Hiwatele had to boost production dramatically.
We had to hire more people so that we could produce 24/7. We had to expand our distribution infrastructure by leasing more trucks and importing more canisters, the cylinders, to allow us to meet the demand of the market. Basically, if we compare our pre-COVID and at the height of COVID, the demand doubled.
Though Kenya may have been spared the worst of the pandemic, Dr. Olayo and other experts are hoping vaccines will help ease the pressure on the country's healthcare system. Kenya has already received its first batch of just over 1 million AstraZeneca vaccines. A total of 24 million doses will be administered across the country in a 3-phase rollout. The first phase has already begun, targeting health workers, teachers, and those in the security sector. Most Kenyans could be vaccinated by 2022, but the timelines are much worse in other parts of Africa, with full rollout expected to be completed by late 2023, if at all. So why isn't Africa receiving the vaccines it needs? Let's take a look at how vaccines get to Africa. Most low-income countries will rely on COVAX, the WHO initiative aimed at securing 6 billion doses of vaccines for poorer countries. COVAX will only cover 20% of the population of each country. The first 2 billion doses will be administered in 2021, primarily to healthcare workers. The challenge is COVAX must first procure these vaccines, and this is getting harder as richer nations race ahead of poorer ones buying up crucial supplies. Canada has pre-ordered enough vaccines to inoculate its population 5 times over. The UK and the US have bought enough vaccines for 4 per person, while the EU and Australia will have 2 each. Consequently, the African Union has entered into bilateral agreements directly with vaccine manufacturers, successfully procuring 270 million doses of vaccines for the continent. But it's hardly enough for Africa's 1.3 billion people. Furthermore, these agreements tend to be more expensive. South Africa paid 2.5 times more than European countries for the AstraZeneca vaccine. To make matters worse, these orders have been complicated by export controls introduced by the European Union. This mechanism gives countries the power to deny authorization for vaccine exports if existing contracts within the EU have not been met. An alternative, as advocated by South Africa and India, is to push the World Trade Organization to allow for any patents related to COVID-19 vaccines to be waived. This means that anyone, anywhere, would be allowed to manufacture the vaccines quickly and cheaply.
It's in essence a very, very fair and very reasonable demand to say, listen, during the duration of the COVID-19 pandemic, we all need to be able to manufacture what can help us get out of the pandemic.
The proposal has received the support of the African Union, but has met stiff opposition from some of the world's wealthiest countries, including the European Union, the United States and Switzerland, all of whom are home to major pharmaceutical companies.
It goes against the language, of course, of equitable vaccine distribution. So we can, of course, only speculate as to why they don't want to support the waiver, but the consequence, in essence, is that they don't want to share, and that's perhaps the reason. They don't want to share the ability and technology to manufacture vaccines.
It's a sad situation for the global health community, because you'd imagine that this would be the only time when people's lives would matter more than profits. Even Kenya as a country has capacity to reconstitute and develop these vaccines if that patent was waived. We can do it quickly, and that would be the best way, produce and deploy quickly within the country.
Sadly, it's not the first time that Africa finds itself facing unequal access to life-saving medical treatments. In 1998, 39 international pharmaceutical companies sued the South African government over its attempt to buy cheap HIV medicines from India, rather than expensive antiretroviral drugs from the United States. Though the case was eventually dropped due to public pressure, the damage had already been done. Delays in procuring affordable ARVs resulted in many unnecessary deaths.
During a time of pandemic, it cannot be left to the market forces, to the monopolies of a few pharmaceutical manufacturers, to determine the availability and secondly, the price, in this case, of vaccines and in the past of ARVs. If we are reliant on the rest of the world, wherever that is, to supply our vaccines, Africa is going to be last in line again. And that is what we're seeing now with regards to COVID-19 vaccines.
The pandemic has exposed and exploited the inequalities of our world. There is now real danger that the very tools that could help to end the pandemic, vaccines, may exacerbate those same inequalities. Vaccine nationalism might serve short-term political goals, but it's ultimately short-sighted and self-defeating. We will not end the pandemic anywhere until we end it everywhere.
Vaccine nationalism happens when governments sign deals with drug manufacturers, especially the ones in their own countries, to exclusively supply the necessary medicines to their own populations, as is the case with COVID-19 vaccines. The world has also witnessed cases where governments push their companies to be granted exclusive rights to supply medicines during disease outbreaks, like the Ebola outbreak in West Africa. The Democratic Republic of Congo has also been a theatre of similar events, as the Ebola outbreak continues taking grim twists and turns. Companies from Asia, America and Europe competed to supply their vaccines to the Great Lakes nation. In the race for a COVID-19 vaccine, some African governments and private researchers were part of the groundbreaking medical achievements recorded, but it seems Africans were less appreciated as the bragging rights ended up in Western capitals. For example, phase 3 trials of the Pfizer-BioNTech vaccine were conducted on South African citizens in October 2020. In November, the Oxford AstraZeneca vaccine was tried on 400 volunteer Kenyan health workers. But when it comes to the acquisition and procurement of these drugs, it seems Africa is left playing second fiddle.
According to me, try it first on animals. See how it reacts, then and if it is okay, we will accept it.
My work has been affected, but if it is possible for everyone to be vaccinated, people will be free with life, freedom of movement, freedom to do their activities without the corona restrictions. That is my hope. I'm eagerly waiting for the vaccine.
I'll not get vaccinated and I'll not allow my family to do it. What if it has side effects? They could be revealed after many years. I don't trust new commercial vaccines.
I'm very scared, so I don't think I'll take it now due to what I'm hearing from people.
I'll take it because there's no problem taking it, and to protect myself and protect others.
Dr. Olayo believes more needs to be done to address skepticism and misinformation.
So it's our responsibility as a public health community to educate the public and to explain to them the merits of vaccination. There are so many vaccines coming in. How different is AstraZeneca from Pfizer and from Johnson & Johnson? This is deep science that an average Joe will not understand. So you need, and he's supposed to take that vaccine and to bring his kids to take that vaccine. So we need to educate them.
A year on, the disruptive nature of the coronavirus pandemic has become the new normal. Though there are some countries that are yet to embrace the importance of fighting on one front against this common enemy. So as long as vaccine nationalism dictates the means, COVID-19 shall be the end.